Hey guys, my name is Nick Sivrich. I'm a physical therapist, and I want to go over this week's question of the week. This week's question of the week, actually I wrote a blog about last week. The question is, when I'm in pain, should I still come into physical therapy? And the short answer is yes. 9 times out of 10, the patients that I'm seeing, or if you're coming to see me, have some sort of pain that is debilitating them, that is limiting them in some way. Whether they've had surgery, whether they had an injury, whether there's just something that it just started out of the blue. But most of the time, when you're coming to see me, or when you're coming to physical therapy, there's some sort of pain involved that you want rid of. And also, whenever you're coming to therapy, there are times when you are going to get flared up, especially after your first visit. I usually tell my patients, after today, you're probably going to be more sore than you were when you walked in, or more sore than normal, but that's perfectly normal, because just think about it. If you're going to start a new program, whether it's a new exercise program, fitness program, whatever, you're not just going to do it and then feel great. You're going to be sore the next day, you're going to be sore a couple days later, you may even be sore a week into it. And that's just kind of a delayed onset of muscle soreness that your body reacts from norm or new activity introduced to it. So I always tell my patients that you're probably going to be sore for a little while. And anytime I introduce something new to them, there's a possibility that they could flare up. Now there's also times where things could flare them up that aren't supposed to flare them up. And they'll call me and say, I'm in a lot of pain, should I come in? I'm like, yes, you come in. We can modify the activity that we did. We can figure out exactly what caused the problem and focus on that. But not coming into treatment because of pain, it really isn't an option. And I tell patients that. And some still will. Others will just kind of use that as an excuse not to come in. But for the most part, I always tell my patients that there will be times that you might get flared up. And at that point, call me, we can discuss it over the phone, we can modify things. But I never, ever want you to cancel on me, because, what they're going to do is they'll cancel because they're in pain, and then they'll take a pill. And that's really not doing anything. That's just going to, mask the problem of what's going on. But, everyone wants that quick fix. And if they're not getting it, then they're going to go to that. And, I highly advise against that because, physical therapy, if you're coming to see me, you're not getting addicted to me like you will a pill. You're not going to have, reversible side effects. You're not going to kill your liver by coming to me, So if you're in pain, if after a few visits you end up getting into pain, that is okay. That is perfectly fine. I know it's easy for me to say that, but it's okay to be in pain. But you're coming to see us because of that pain. So, stay the course. Things aren't going to go away overnight. And, try and just stay consistent with it. I hope that helped this week. I hope that provided a little bit of value. If you have any questions, feel free to contact me. You can email me also at nicksivrichpt@gmail.com. And, follow me on my social media. And have a good day, guys. Thanks a lot.